Hello, attendees. Welcome to Facing the COVID-19 Challenge, How to Keep Your Business and Team Safe. Brought to you by Canadian Manufacturing, Plant, and Electronic Products and Technology magazines, along with our parent company, NX Business Media. This webinar will help manufacturers to navigate the choppy waters created by the novel coronavirus, or COVID-19, a dire threat to both human health and economies across the globe. My name is Will Masgay, your host for today's webinar. I am the editor of Canadian Manufacturing Magazine, the manufacturing sector's top source for daily industry-focused news in Canada. An exclusively digital brand, we provide breaking news and in-depth stories on a wide array of subsectors across the manufacturing landscape. We host events, award programs, roundtables, webinars, and other forms of specialized content. This webinar is also brought to you by Electronic Products and Technology, or EP&T, and Plant magazines, as well as NX Business Media. For more than 40 years, EP&T has been Canada's leading source of news, technical information, and products serving the electronics engineering and designer community across the country. Plant magazine is Canada's business publication for manufacturing management professionals, from the shop floor to the executive suite, delivering dynamic content covering management issues, technology, and industry developments. NX Business Media is a business-to-business magazine publisher with over 65 forward-thinking media brands, all of which are built to serve Canadian industries with timely and relevant information and resources. Now, on to today's webinar. As manufacturers scramble to adjust to the new realities of COVID-19, they are dealing with a myriad of concerns, such as financial health and liquidity, managing with reduced staff, managing sudden operational slowdowns or closures, initiating an effective communications plan, raising the cleanliness level on the plant floor, equipping managers and workers with appropriate personal protective equipment, and practicing social distancing in tight work environments. Today, we will seek to address these and other issues with the help of our speakers. Dennis Darby, President and CEO of Canadian Manufacturers and Exporters, and Steve Loftus, President of Barrie, Ontario Manufacturer Innovative Automation. Each speaker will provide their thoughts on how the COVID-19 crisis is affecting the Canadian manufacturing community and offer some potential solutions. Following remarks from Dennis and Steve, we will open the floor to questions. Please reserve all of your questions until after the presenters have finished. We will endeavor to answer all of your questions, but time constraints may force us to cut things short. First up, we have Dennis Darby. Dennis joined Canadian Manufacturers and Exporters, or CME, in 2017 after 9 years as CEO of the Ontario Pharmacists Association and a 24-year-long career in senior management at Procter & Gamble, including leadership roles in both the US and Europe. Dennis graduated from McMaster University in 1984 with a degree in chemical engineering and management, and he is a registered professional engineer in Ontario. He is an accredited corporate director, having received his ICD.D designation in 2011. And he has served on a number of industry and charity boards as both director and chair. Take it away, Dennis.
Well, good afternoon, and thank you, Will. Maybe we'll just go to that first slide. Then about CME. I think let's go to the next slide. I'm President and CEO of CME, and as Will said, we represent over 2,500 manufacturers across the country, and normally we offer a wide range of services, everything from lean training to networking events and to safety certifications and advocacy. But right now, all of this is on hold. In fact, right now we're investing all of our resources and our staff time in two areas. One is helping manufacturers get the support they need from governments to make it through this crisis, and helping manufacturers access the information they need to run their operations, to keep their workers safe, and to keep them employed. So those are the two things. Let's go to the next slide. I know it goes without saying that the pandemic is having a devastating impact on our economy. In an internal survey of our members just over the last week and a half, we see manufacturers struggling with supply chain issues, concerns about cash flow, and of course, keeping their workforce healthy and in place. So our goal is to work with government to develop policies that flatten the virus's spread, but really also flatten the economic curve. and we're working with a number of governments, federally and provincially, to find solutions to limit the impacts on manufacturers. So far, the government seems to be listening, and they've adopted many recommendations that manufacturers have put forward, specifically things like halting the collection of payroll and other taxes, halting or deferring fines and audits, freezes or cuts to hydro rates, property taxes, in some cases mortgage payments. There's been a fund to scale up the manufacturers to help defeat COVID-19, and really methods to expand and simplify the EI system, which we hope will come into fruition very, very soon under the new Canadian Emergency Response Benefit and work sharing. But finally, the 75% wage subsidies available to all employers who can show a 30% decrease in revenue is probably the best measure that will help and have the most immediate impact on business. We're working with the government. In fact, I was on the phone this morning with government. This needs to be easy to access, because the last thing that manufacturers across the country need right now is more red tape and uncertainty. Now, many provinces have begun to shut down all non-essential businesses, but manufacturing is exempted for the most part. Ontario is the model. We work with them to ensure that we have an exemption on manufacturing here and the supply chains, transportation as well. Quebec's a bit more restrictive, but we hope to see them expand the list as well to include all manufacturing and supply chains. But that's really important, because this is all about being able to do the work we do. Let's go to the next slide, please. The fact that manufacturing was declared an essential service and plants remain open means that manufacturing workers are on the front line. It's understandable. Not all employees are willing to do that based on their own health and family situation. Manufacturers need to be ready for and are already seeing a high rate of absenteeism, and they need to adapt, and that's what we're going to talk about today. For the workers that remain, how do manufacturers keep operating and keep their employees safe? And creating clear and easy to follow guidelines is the best way to keep employees safe, and also to instill confidence in the workforce, because that's really important. Let's go to the next step. The next slide, please. Thanks. The first step is obviously to assess who should be on the site. There should obviously be no visitors unless it's approved and it's really necessary. Everyone who does not need to be physically located at the operation should be working from home, and many of our members are, their office staff are working from home. Employees should ensure that some workers just shouldn't come to work. Anyone with COVID-19 symptoms, that's pretty straightforward, or who has to self-isolate, or someone who's caring for someone who has the symptoms. Any workers who've traveled and must remain away from their workplace for 14 days at a minimum, and workers who share a residence with a person, like I said, who've been exposed. And many companies are talking about contractors essential to the business need to follow the same rules as staff and follow all the same procedures. Let's go to the next slide. The second step that our folks have been talking about with manufacturers is obviously creating social distancing in the workplace. Now, that's not always possible, and it'll vary from one workplace to the other. What we've been talking about are things like staggering shifts where possible, so you can do cleanups, staggering breaks, closing cafeterias and break rooms, separating workstations, separate seating, taping off places. One manufacturer blocking off every second urinal in the men's washroom. Trying to use tape or separation barriers to remind people about the idea of that 2 meter or about 6 feet separation, and of course limiting face-to-face meetings. Webinars like this and Zoom and other things are becoming more and more the norm already. Let's talk about the next slide. Other preventative measures that companies are putting in place and are increasing sanitation in common areas like bathrooms, door handles, and workstations. We've developed a tip sheet through our safety group out west and in Newfoundland for manufacturers about cleaning and disinfecting protocols. I'm sure my colleagues are going to talk about in a little while. But make sure there are adequate supplies. Make sure things like tissues, poly barriers between workstations. Don't share tools, and if it is necessary to use common tools between workers, find a way to disinfect between usages. Let's go to the next thing, because this is really important. This is what we found over and over on our webinars with our staff, with our members. Communicating. Internal communication is critical. You need to make sure that someone is responsible for communicating with the team and from the team. Make sure you have signs everywhere. This is one time where I always say over communicating is probably better than under communicating. And don't assume everyone is aware of the basic precautions. Put them in a poster, post them everywhere to reinforce the message. Wash your hands and how to wash your hands. don't shake hands, don't share food, use social distancing, cough into your sleeve, how to dispose of used tissues. These are all things you would obviously think are obvious, but they're not obvious, and everyone needs to be thinking about this as well as their job. And make it clear who is responsible for cleaning and disinfecting what and when in your location. Other protocols, obviously we need to consider things like sick reporting protocols, how to enter and exit facilities. What do you do when someone has a positive test? What is the return to work protocol? These are things that we've been developing tools. In fact, if you go to the next slide, if you really want to know, we have a COVID-19 webpage on our website. It's open. It's not just for members. It's for anybody. It has resources to help manufacturers navigate this. You can register to our newsletter, or we're doing twice weekly calls to have access to the latest information as we bring in experts from across the country. It's safe to say these are obviously not normal times. But we are enthused that the government has recognized so publicly the importance of manufacturing. I can tell you in my 30 odd years of work, it's the first time manufacturing gets so much profile. Unfortunately, it's at a terrible time, but we have an important role to play both in the COVID-19 product procurement area, the companies that can help and contribute as contractors or manufacturers, but also to keep the economy running. It's really, really critical. So thank you very much for this opportunity to speak today, and I'm happy to answer questions after my colleague has spoken. So back over to you, Will. Thank you.
Thank you, Dennis. That was incredibly insightful. So next up, we have Steve Loftus. Steve is the president and one of the founding partners of Innovative Automation of Barrie, Ontario. As part of the Innovative Automation leadership team for the past 30 years, Steve's focus has always been on the creation of an environment where every innovator is given the opportunity and the tools to become the very best they can be. This long-term thinking is sometimes difficult to follow in situations and requires strong leadership to stay the course. Strong leadership has allowed Innovative Automation to position itself to be the first choice provider of automation solutions to the global leaders in manufacturing. The key to Innovative Automation's mission statement is to lead. This includes all aspects of business, including globally and locally. The floor is yours, Steve.
Thank you. So at Innovative, having been in business for 30 years, we have a little bit of history that we can rely on that will help us through this COVID-19 pandemic. So if we go back and look at our policies and procedures, they were developed during the SARS pandemic in 2003. So I think this one thing that we need to learn from this, particularly from an HR perspective and a health and safety perspective, is this is an opportunity to learn, because this will happen again at some point. So when SARS happened, we developed policies on how we would handle situations such as this pandemic. Procedures were developed and were put in place at that point. Those were actually updated again when we had the H1N1, which was not technically a pandemic, but definitely a health scare. And then when COVID-19 became a pandemic, or even prior to that, we were visiting those procedures to make sure that they were still correct procedures, and some of them had to be updated. Things that we learned from those previous pandemics or health scares was what we need to do in the workplace initially. So cleaning is the first thing. So there is a crew of people that actually clean down common surfaces 3 times every day. So before lunch breaks, when most people are moving through common areas, kind of before break at the end of the day, and then at the end of the day, we wipe down again, ready for the next morning. So that cleaning process was developed during the SARS, and we enacted that early on, early March, where we're putting that in place. So that cleaning. The next thing is a group was assigned to become educated on what are the health risks and what are the risk factors so that we could start to plan. So that was kind of the next step, is to educate ourselves so that we were making correct decisions early on. We then invoked travel restrictions. So anybody that was out of the country for work or even on vacation, we were restricting their re-entry into the building back as early as mid-March. The other thing that we have done is we restricted the amount of visitors. So there is no sales or people allowed into our building unless it's for something critical. And we have really in the last 2 weeks had about 4 visitors into our building, which we're trying to control everybody that's coming into the building to ensure that we're minimizing risk to our employees. Our shipping and receiving department has special procedures because they're actually interacting with courier drivers and transport drivers. So those PPE restrictions or policies are different for shipping receiving than most of the company. The other thing that has gone on is the educational portion, which Dennis had spoke about early. We did talk to our employees frequently early on, and as this pandemic started to grow, those discussions became multiple groups, smaller groups. The next thing that actually became was online. And about 2 weeks ago, we took everybody that did not actually need to be in this building and moved them to work from their homes. So our IT department had a bit of work for a couple of weeks to kind of prepare for this. We knew that it was probably coming. So the IT department, we gave them a bit of a head start to kind of put this in place. So at this point, we have over 50% of our employees actually working from home, either on self-isolation because they were out of the country or because they chose to work at home or could work at home. Now, not everybody can work at home. We're a manufacturer, so about half of our staff is still in the building every day. So we had to make changes to procedures. So our lunch breaks and our normal work breaks have been split into 3 groups. So we're only putting about a 1/6 of the load in our lunchroom at a time, which means we're into about 20 people in a lunchroom that holds about 160. So everybody's spread out. It kind of looks funny. You walk in and there's 3 people at a table and they're spread out by 10 or 12 feet. But that's just some of the stuff that we've done. We had restricted entrances into our building. We have someone comes in the morning and actually opens and props all common doors open, so people are not handling doors, doorknobs, anything like that. No one has to touch them. They basically walk through for that. One of the other things that we do is there is at 3:30 or 4 o'clock every day a half-hour management ownership meeting online. Even if I'm sitting down the hall from another manager, we actually do it online through Teams. This is set up and works very well. So we talk about things that may have changed during the day, issues that have come up. We have created policies or procedures now for return to work if you have been out of the country or if you have been ill. We've generated sign-off sheets for our employees to review and make sure that they understand that all of those questions need to be answered properly and correctly so that we can protect all of our employees. So those kinds of things are all in place at this point in time. We have a lot of questions from employees, which is fine. It creates discussion, and that discussion will lead to changes maybe in what we're doing or better communication. To go along with that, we've created our alert system. So within our alert system, we have asked every employee who has a cell device, whether it's personal or company, to put that number forward. It's not used for corporate business, but it is used for alerts. So every day there's an alert that goes out to all employees that kind of gives them a little bit of a taste of what's going on in the building. So we're keeping connected to them, and we're also able to share things that have changed. Part of the positive side of this is Innovative has stepped up and started to generate face shields. So it's good to actually have positive news to share with our employees at the same time that we're communicating maybe restrictions or procedural changes. So that is very good. The face shields are being manufactured. We have a team of 8 people running a line that we built in the last week that is able to produce those shields, and we're sending them to local hospitals at this point in time. The other thing is we're developing a ventilator, our 3rd prototype we just finished this morning, and it's ready to actually go do some testing and validation, and hopefully we can get a Health Canada approval on it and start manufacturing these within a week. So all of those positive things can lead to some very positive energy within the building in a time that somewhat seems a little bit bleak when you look around your manufacturing facility and it seems near empty. So I think part of it is we need to generate positive news when we're communicating to our employees to make sure that they're engaged and they can feel good about something that they're doing. And part of this is to have, for Innovative anyhow, is to have our employees come forward with these ideas and drive them through to the manufacturing state. And that's part of, leading locally for us as a company. It's the validation that our employees are driving these aspects of our business and not us as owners or managers dictating what has to happen. These people are part of the community, and it's important that they get an opportunity to give back personally. So those are a few of the things that we've done. Our HR department is dealing with the temporary layoffs that come with people who don't want to be in the building because of health issues, and backfilling those roles. We've been successful at doing that at this point in time. But everything from, cutting checks, which means someone has to handle paperwork, all of those types of things, all those procedures have to be changed. And I think it's important that we keep track of what we had to do and develop procedures going forward afterwards to maybe make us a little bit more isolated in some of the things that we do, so that if this happens again, we're prepared, or maybe limits what happens if there is another outbreak of whatever virus or flu comes along next. So I think at that, I'd like to turn it back over to Dennis.
I think Will's going to take us through the next section, but that's fantastic, Steve. It's a great story, and I want to just echo what you said. The idea, the fact that you guys are stepping up, but also to try to get some positive news, and we've been really trying to make sure that manufacturing stays in the news, because it's important for our workers, for the people to know that what they're doing is important and it's relevant, and that we as business are doing our best to keep them in place.
Thank you so much, Steve. That was very insightful. You gave us a lot of fantastic information to chew on. So at this point, I'm going to open the floor to questions. So for anybody who has a question, please type it into the message widget in the questions tab of your GoToWebinar user interface. We will try to answer all the questions in order. Please bear with us. We might get to all the questions, we might not. Time constraints may force us to cut things short. And if possible, if you could please direct your questions to either Dennis or Steve, that would be fantastic. So, we have a lot here. Okay, so first one is for Steve. As a manufacturer, how has your firm managed employee fears or anxiety over getting sick and contracting COVID-19 by coming to work? So have you had some manufacturing employees opt to stay home, and what sort of challenges has this brought on?
We have had 6 people who have opted to stay home. For us, it was we were very fortunate in the people that opted to stay home. Just a second, I turned my phone down. That opted to stay home. Those positions were able to backfill, but early on here, we moved most of our engineering people and programmers out of the building, which represented about half of our staff. So our finance, accounting, HR, programmers and engineers moved out of our building, which is about half the staff. So really we were left with our manufacturing staff, and of those we have 6 people who either opted to take vacation time or go on layoff outside of the building. So we're okay manpower wise. We've kind of ramped up now a bit, adding production line to build face shields. So we've reached back out to family members. We're trying not to introduce extra households, shall we say, into our company. So we reached out to family members to actually man that line. So we've been very fortunate. I know other companies are struggling because they have key people that need to be in the building. And I think the whole secret here is to figure out a way that that person can limit their requirement in the building. Even if you can get them down to maybe 1 day a week in the building and 4 days remote. There are all kinds of great softwares. We've used Teams really well. There's 7 or 8 teams based on different areas required to deal with COVID-19 that have been created, and people can be part of that communication without technically being there. You can share documents on it. So it's just a different way of doing business, but it can be overcome for a lot of people.
So our next question is for Dennis. Based on your recent survey of manufacturers, have they experienced difficulties accessing or obtaining adequate cleaning or sanitizing supplies such as gloves or masks?
Thank you for the question. And in some cases, yes, and we're doing our best through our CME staff to try to match up suppliers and manufacturers. What we're seeing in some communities is companies sharing, and what I mean sharing supply if you've got in a local area. But this is something we've been working with the associations that represent the cleaning products, and we're making some progress. But yes, it has been real, not to a great extent, and I think. And I think after the initial shock, there was a real rundown of inventories all over Canada, and I think that those are coming back. Someone said to me the other day, at the end of this crisis, we'll probably have more hand sanitizer than we ever wanted, but that's okay in the short run. But yeah, so that has been a concern that they've. But I think there are a lot of groups, and if somebody is looking for that, let us know through either my email or others, and we'll connect you to somebody who's closer to it. But that's a real concern, because it's and it's also the issue at the consumer level of hoarding, but and that's something that we're trying to talk to the manufacturers themselves or distributors about, making sure that we do prioritize the manufacturing or the industrial sector.
So this next question is a general question. Do you have a resource you could share for performing a risk assessment for workers before they start their shift every day? I.e., have you been ill? Have you been out of the country? Have you been near someone with the virus? Just
we have. I'm sure Steve's got one. We've got one on our COVID-19 webpage from our MadeSafe group in Manitoba and our MadeSafe group in Newfoundland. So those are available. Those sort of checklists. But I'm sure Steve, you've probably got one that you've used locally.
Yeah, so our HR department has developed the checklist as well, which basically is the criteria set out by Health Canada.
Exactly.
This next question is for Steve. Could you please share some more details on procedures and PPE for shipping and receiving staff?
Okay, so we have one advantage because we're building face shields. So those people are wearing face shields. They're wearing gloves to handle packages. Those gloves are basically disposed of after every packet's basically unpackaged and shelved. The risk factor in storage is minimal for hard goods, so we're good there. So it's more the contact interaction between, let's say, the FedEx driver, the UPS driver, or the transport truck driver and the shipper receiver is the bigger issue. So we deal with those with PPE.
Another general question, how do you handle situations where multiple employees are handling the same item in a manufacturing environment?
Well, we have to look at if we're in an assembly process, we're trying to limit that in our normal machine building. The development of the face shields that we're dealing with are basically hand passed down a line through 8 different people. So we have those people are wearing face shields, they're wearing gloves. So hopefully we're protecting the product from the start, because the first person handling it is not handling it with skin and with their face covered. They should be not generating any droplets onto the product, so the virus should not be moving between those people. But we have that advantage that we have face shields. I know there's lots of varying stats on the masks. I'm not sure they're quite as effective as people think they are, based on what I read. But we're trying to limit the expulsion of the droplets from one person onto a product to another person's hands and then back into their respiratory system.
I think, and Steve, the other thing we've seen is companies putting like sort of poly barriers between between the workstations and also between the worker and the actual part or material they're working on. And you're absolutely right. It's about and also reminding people to continue to do the things that they already do, which is frequent hand washing, don't touch your nose, eyes and face, using non-skin contact, and often putting physical barriers even between at those various stations. So I think I think we've seen, and I think the idea of face shields are a great idea as well. Masks, yes. Right now, I think for the listeners out there, the whole area about the use of masks, which really are meant to only be used single use. I mean, once you put them on, if you take it off, you need to replace it. And I hate to say it, the jury seems to be out. Some countries are using it, some are not using it. We're watching every day to try to see what is the best advice for public health.
The next question here is it necessary to provide hand sanitizer even if you have a lot of soap available and employees are washing hands regularly?
For our company, it seems to be, or our policy is either or. So either you're using hand sanitizer or you're washing your hands for a minimum of the 20 seconds. And it's funny because if you add a bit of, let's call it light humor to it, people kind of sticks in their head. You know, they've got some song out here that you hear everybody singing, and they sing the chorus, and that's 20 seconds, and so that's the reminder of, you know, how long you wash your hands for. And some goofy pictures of my partner who's short with long hair, so they got a picture of him sideways with his hair standing straight up. So everybody's kind of laughing and talking about it. But you know what? Because they are talking about it, they now have in their head what that 6 feet is, or 2 meters, right?
And I think what Steve said is it totally makes sense. You know, reminding people, putting more signs up. It's just, you know, we all get out of the habit, I guess, you know, from school, we get out of the habit of washing our hands probably more than, and now we all know it. In terms of the between hand sanitizer and washing hands, you know, the best information we've got is washing your hands with, you know, with soap and water for the right amount of time in the proper way is, you know, is sufficient. But I think many people feel there. I think there's a sense, many manufacturers, that making those hand sanitizers available, it helps. It reminds people. It provides a little bit reinforcement, but we can't overemphasize every time, you know, that you leave the workstation, or you touch your eyes or your nose, or you cough or sneeze. I mean, you should probably wash your hands. It makes good sense, and it's the best way to protect our workers at the right on the floor.
Okay, the next question is for Steve. What is the procedure if you have a case of COVID in your plant? Do you shut down and send everyone home for 14 days?
I don't believe it's 14 days, but we will shut down. We're trying now to actually split our facility into 2 different work areas, which we can, because we have facilities for 2 different lunchrooms, and can split the washroom facilities. So our idea here is that one half will use one entrance and a different washroom lunchroom area, and the other half will use a separate entrance, exit, and separate lunchroom facilities. And then we will ensure that we're not crossing those 2 sections. So that's the rule. I'd have to actually look at the procedure, but the procedure is as dictated by Health Canada. It's on our sheet. I could actually look it up and see what it says, but I do not believe everybody goes home for 14 days. You monitor for symptoms and then return to work accordingly.
Yeah, I believe there's a procedure in most places. I've seen procedure to do a clean of all the common areas as well, but no, I don't think it's 14 days. But you'd have to go through a protocol to clean the common areas where people might have been exposed. There is a lag. You're right, Steve.
Yeah, the cleaning procedure is wait 24 hours, clean, yes, and then wait 24 hours, and then repopulate the area.
This next question is for Dennis. Can CME coordinate the mask demand on behalf of members?
You mean the face shield or mask? We are working with a number of companies that are in the manufacturing realm. Yeah, we'll do our darndest, but right now we've been talking to companies who've been ramping up production of making masks, but the key thing is getting these things approved. So I assume we're talking about the face masks, the N95 or less than N95. Yes, we're look on our COVID-19 page. We are looking to make sure that we get enough manufacturers, and then how do we actually get them out to people. This is a work in progress. It's not done yet, and I'm hearing this week a bunch of small companies ramping up. Key thing is to make sure we get these things that they are effective, because right now they have to make sure that they are effective. We've been in contact with the companies that manufacture them and trying to make sure they're sufficient for not only our frontline healthcare workers, but enough for all industry. I don't think we've got it yet, though I do know a couple of companies, including 3M, and are working to find contract manufacturers to ramp up. So this is it's a work in progress.
This next question is for Steve. You mentioned that some of your procedures had to be updated. Would you be able to provide some examples?
I'd have to go through HR. These were done early on, but I can share that afterwards if anybody wants to reach out, to my email address after this, and I'll get a list of those and send them back to you.
There's another one here for you, Steve, that's somewhat related. As the crisis developed, what were some of the decisions that you took that were particularly difficult, or what were some decisions that required some alternative courses of action or some outside the box thinking? Would you be able to elaborate on that a little bit?
Well, one of the big things was to understand that this was coming and to invest in the infrastructure to make sure that we could maximize the number of people that were working outside the building. And a lot of that has to do with being proactive. We had procedures in place before, and it was like, okay, what happens if we have to send, 3/4 of our staff outside the building? How is that going to work? And we explored, working in shifts. We explored a lot of different things, but our infrastructure would support those people working outside the building. We were able to generate enough, particularly for the engineering people that are doing design. We were able to generate enough computers to supplement their home computers, if that's what they're working off of, with something a little more powerful to fit all of those needs. So initially we had about 5 people out of the 30 in engineering working in the building while we put those assets in place so that those people could actually move outside of the building as well. So there's some of that. It's you have to explore every option, and the solution may not be a single solution. You may end up with 3 or 4 solutions, and you need to really communicate that strongly, because some employees will perceive it incorrectly if someone has a different situation than them. And I know at times we struggle sometimes trying to fit everybody into the same pair of shoes, but the reality is everybody has different size feet. So we need to have multiple solutions and make sure that people understand that one size does not fit all.
So switching gears a little bit here, this next question for Dennis deals with more longer term thinking. So generally speaking, what is the level of anxiety in the market as it relates to free cash flow, and what measures do you think manufacturers should be taking in the short term, say April and May, for example?
Boy, if I knew the definite answer to that, boy, I would be better than the finance minister. But here's what we know right now. I think, as you've heard, government is making, quote unquote, making more money available, some short-term loans available. You need to watch your cash flow. At the end of the day, remember that at the end of through all these programs, many of these things are deferrals in some cases, or you maybe defer on your rent, defer on your hydro. You're going to have to plan to be able to bring that back. So I think everyone should be looking at as we look at it, a 3 to 4 month cash flow, and understand that when this is over, there will be a huge. We've all put together as a country and as manufacturers, we'll have a huge bill to pay. So start planning for that now. But we are trying to get details, and apparently we'll have some details today on the terms and the conditions on both on the short-term, the additional short-term loans, the wage subsidy, and of course, if you have been working with BDC or EDC, that's proven to be obviously complicated, but we've been reassured by the heads of both those organizations that the money will begin to flow. But always remember, it's not free. I think there's about $10,000 per company that's free. That's the forgivable part of the emergency loan, but everything else, you have to plan for. So for manufacturers, everyone understands that both the suppliers, your suppliers and your customers, everyone is slow to pay right now. And we hope that you can keep as many of your staff on as possible, but we need to get the details of how to make all these sources of direct subsidies and or short-term loans, how to make them accessible.
This
Just
next
if I
question, sorry, go
can
ahead,
I
Steve.
just jump in there a little bit? Yeah, because we early on really looked at we call it burn rate on our cash, because we know that our suppliers are going to be slow to pay. And we really studied what that burn rate was and what we can do to maybe slow it, and what things are not necessary, and what opportunities should we step up and take, because there are opportunities right now in business because people are slower. So just really understand the cash flow. That's the
Amen.
most critical thing, and don't be afraid to slice away even the smallest pieces, because a bunch of those small pieces will add up.
Well said, Steve. I think that's the advice we're giving everybody. You have to look at this is not the time to be preparing a long-term budget. It's more look at your burn rate, your cash flow, and what can you defer, what can you partially pay, what can you advance, because depending on which economist you listen to, at the end of this, we'll either have a fast V recession and a recovery, or we'll go right into recovery. But we have to be ready for when we get through this latest event.
This next question is for Steve. Given that you guys, number one, you're still operating, and number two, you're making face shields, are you hiring? What's your stance on recruitment, or is that put on hold for the moment?
No, we are hiring. Like I said earlier on, we're trying to hire people out of the same households that are coming into the building presently. So that's our first priority. So we've have a few people. They're either spouses or adult children that are still living at home that have been displaced. So they're looking for work. So we're trying to control the spread by limiting the number of households people are coming from. So, that's kind of our recruitment. We reached out via, our daily message to our employees. We need probably 16 people total. We had 17 people put their name forward within 20 or 30 minutes.
Okay. The next one's for Dennis. How prepared would you say manufacturers or your members in general were for this pandemic in terms of their structured risk management plans? And maybe if you could discuss some of the elements that should be covered, both in adjusting to the new circumstances and in preparing for future pandemics.
Well, I think the one thing we've learned from as we talk to members out of this is that many companies that had supply chains which included China in even before it really hit here, companies are already having to realizing they had to adjust and be prepared for changes to the whole speed of supply chain and in terms of how fast things are turning around. So I think some companies were better prepared than others. Those that were more internationally exposed felt it right away. But I think the question is very good. This is the time more than ever to work on your emergency management plan and to be prepared for. Do what you can through this one, but be prepared for the next one, because I think, as Steve mentioned, this will happen again. And I think the companies that have put the procedures in place, I think some of the procedures we've put in place that people like Steve and other companies have done, I think these may stay in place. I think that discipline in terms of how we interact, I think we may change a lot how we interact with each other. But in terms of supply, I think we've heard a hue and cry from many companies saying, boy, we need to get less dependent upon single source materials or components. And I think there'll be a complete believe there'll be a complete relook at the whole manufacturing infrastructure in the coming months. So once people get their systems in place to be able to deal with this, I think there's going to be a lot of discussion about is there a better way in the future to protect ourselves and our supply chains in times where it may not be as I guess we all take it for granted, pardon me, that we've had these global supply chains which we can get parts, materials, components, ingredients from anywhere, anytime, as fast as we need them. I think a lot of those assumptions are being challenged.
Can I just jump in there? I'm hearing people are talking more of a continental supply chain versus a global supply chain through this. So, that may be something that the listeners may want to start to address as part of their risk management.
So for Steve, how do you handle used PPE? Do you label it as biomedical waste or regular solid waste?
We have been just using it as solid waste at this point in time. I do not believe that this virus can live more than at kind of worst case scenario is maybe 2 days on a hard surface. And that's still questionable whether it's even that long.
That's the outside limit that we've been given by public health, Steve. And you're right. That's probably, but who knows? Things can change.
Okay, we have a question here. I guess both Dennis and Steve can take a crack at it. A case study, really. So this individual had an employee test positive. Their plant was shut down for 24 hours and then reopened. The common area was sanitized by a professional cleaning company. So this manufacturer is wondering if you guys have any advice on how to make employees feel comfortable and safe returning to work.
Well, personally, it's all about education. So if you're cleaned based on what the CDC or the Canada or Health Canada says, you need to communicate that to people. People need to understand what is real and what is propaganda based on people wanting posts read. And I think it's really important to drive that home, and that educational portion is a struggle sometimes, but you must stay the course and you must stay factual in what you're communicating.
I think Steve's right. I think all those things we talked about at the beginning of this, in terms of everything from the social distancing, even in the staff rooms, all the hand washing reminders, and yes, the source of information. And please, for the listeners, I know you can find anything you want on the web, and everybody is through their by your smartphone. Health Canada, Government of Canada, we believe that should be your source of truth. And yes, as Steve said, remind workers we follow procedures as dictated by Public Health Canada. We think this is the best way to do it, and I think the more you reinforce that you're taking your direction in terms of how we interact and how we clean from those kind of authorities, the better off we are. We can't have because you can there'll be things online that'll tell you everything every one of your fears can come true. But let's go with those trusted sources, and I agree with Steve. We should be looking at Health Canada and the rules that come out through the Public Health Agency.
Okay, so the next question, this is an interesting one. Are there any legal or human rights issues that employers have to navigate with health questionnaires for staff?
We had an expert on one of our calls, two or three lawyers, and I think right now the way I would say is employers have a pretty wide berth in terms of asking, especially about things related to travel, COVID-19 exposure. So I think it's a fairly wide berth. Obviously, if you've got a unionized environment, you should be working with the union on those questions. But I think there's more latitude than less right now, given the emergency situation.
I believe with the state of emergency that there is a lot more latitude than what would normally be seen. Once that it's a public health emergency, I think the public priority probably supersedes the personal privacy.
Okay, so this next question deals with quality control. In terms of recalls of various masks from China and other places, how can manufacturers ensure that the protection equipment they have is actually working?
So all the equipment you have will have to have been certified, and there's usually a Health Canada or related certification in terms of its certification. Yet be very wary of taking things that may come, you might order online from God knows where. It's and that's our first, and including things like hand sanitizers. Make sure that they are, because the active ingredients are so critical in terms of the what's in those. So we're encouraging everybody, if you are a manufacturer, to work through to get the certification, and if you're a manufacturer looking for supplies, you have to go to reliable suppliers. I know it can be difficult, and I know in the course of a day I'll get 15 or 20 emails from sites I've never heard of offering me all kinds of PPE materials from places I've no idea whether they're certified or not. So I think you have to look. Do what you normally would do, is look for things, good suppliers that you know, and who will give you the quality, and particularly in terms of certification, especially for those things that require either a drug identification number or a CSA certification.
Okay, so we're running short of time, so I'm going to field one more question to Steve and one more question to Dennis, and then we're going to wrap it up. So for Steve, what are some of the issues arising among your employees? What kind of concerns or anxieties do they have, and how are you addressing these, and just generally keeping morale up at your plant?
Well, for us, because we have products that that are conceived to be critical, that's generating the positive that we need. But I think part of it is the whole way that you lead your company, the consistent messaging, being proactive, being ahead of the curve, communicating with your employees what our next steps are, only to have them see in the media 2 or 3 days later that that's the next step that the government's taking. Those proactive leadership skills build trust, and when they build trust, when you communicate to your employees, they feel that you're looking after them, because in reality that's what we're trying to do. And it allows them to be more relaxed at their workplace and produce when you need them to produce. I think part of the thing that people become reactive in these situations, which is not great leadership, and then people don't want to listen because they're getting conflicting information. If the information you're giving them is correct and it's early, they will listen to what you're saying. They know that you're doing research. They know you're looking out for their best interest.
Thanks, Steve. And for Dennis, sort of a macro outlook question. The situation in the US is getting really bad. They're becoming the epicenter of the COVID virus. So things seem to be tracking to get a lot worse there before they get better. How is that situation going to affect Canadian manufacturers, both in terms of overall market outlook, in terms of supply chain, and in terms of just what they need to do in terms of planning for long-term outlook within the North American market?
Well, in fact, I think some sectors have seen that already with the slowdown in a number of sectors, including the automotive and some in aerospace. In fact, yes. So I think everyone needs to plan that you can and will see supply disruptions. You're going to have to plan appropriately to be prepared for a potential slowdown. Even though manufacturing has, in Canada, is obviously most of the big provinces been declared an essential service, so there's no restrictions of what we do other than the ones we've talked about today in terms of staff or supply chain. In the U.S., that is the case as well in most states, but not entirely. And so you have to make sure. I know Steve talked about communication with your employees to reassure them that you have the best information. You need to communicate with your suppliers and the vendors you deal with outside of Canada, because Canada is being affected, will be affected. Will continue, like always. Remember, 80%, almost 80% of what we manufacture, we sell to the States, and almost 90% of what we normally produce are components within the supply chain. So this is a good time to, despite everything, and everyone's working from home in some cases, talk to your suppliers, talk to your vendors, secure what you can, but do not expect things to be going as usual, anytime soon. In fact, I don't even know what planning horizon, but like I said, if you're looking over the next 3 to 6 months, that's probably not unreasonable to say things are not going to be the same.
Thank you, Dennis. That was great. So that's all the time we have for questions. Thank you to everybody for your contributions. And that also wraps up our webinar for today. Thank you to everyone for attending, and thank you to Dennis and Steve for your thought-provoking presentations. Canadian manufacturers are facing a lot of uncertainty and anxiety right now, but you provided some very helpful insights, and I think that together, the manufacturing community is going to get through this. So for more information on the topics that were discussed today, feel free to reach out to either Dennis or Steve. And to learn more about Canadian manufacturing, plant, or EP&T, please contact myself, Joe Terrett, or Stephen Law. Thanks again from all of us at Annex Business Media's Manufacturing Group. Until next time.
Thank you.
Thank you.